New week. Okay, today we are going to be talking about the necessary first aid materials and tools you should have in your home. Yes, you must not be a healthcare provider to own one. Of course, as a parent, you need to have these necessary first aid materials. Very important. Let me refresh your memory on the meaning of first aid. While growing up, we were taught in schools that first aid is the first treatment given to an injured or sick person before taking him or her to the hospital. Now, during the course of my profession, I've come to augment that definition a bit. I would say first aid is the first emergency response treatment given to a sick, an injured, or a wounded person in order to do what? Minimize the severity of the outcome of injury or illnesses before taking him or her to the hospital. Now, I want you to underline first emergency treatment. I want you to underline given to an injured or an ill person, and I also want you to underline in order to reduce the effects or outcome of illnesses or situations then before taking him or her to the hospital. By first emergency response treatment, I mean the first necessary thing you must do in order to keep that your loved one, that your child alive before calling your healthcare provider, your doctor, your relative, Uber, Bolt to rush the person in question to hospital. That is what I mean by the first emergency response treatment. Then I said in that definition again that these first aid treatments will help to minimize the outcome, the effects of what this emergency condition. Hereby I mean that if it was a patient that is supposed to have gone before reaching the hospital, this your first aid treatment, your emergency response treatment would be able to give that person at least, let's say, 1 hour grace period to still survive that situation. Okay, so now you will be asking me, madam, calm down. So now, what are the necessary first aid treatment, what are the necessary first aid materials or equipment I should have? Yes, one of the necessary and very important first aid equipment you should have is your BP check. Of course, they have modified it to the extent that even as a non-healthcare practitioner, you can be able to interpret the result. It even works better that it tells you when it is high and it also tells you when it is low. So as simple as that, you don't need to be hypertensive to own this machine. You don't need to have any BP related issue to own it, but at least it helps give you a picture of what is happening in the inside of that person's body. It might be your husband, your wife, or any of your kids, or even your mother-in-law, your father-in-law. You don't know. You can save a life one day with that machine. Another equipment you should own in your home is glucometer. It is a small device that is used to check what your glucose level, or let's say your plasma glucose concentration. Yeah, that's a more, yeah, click it. So you should own a glucometer. You must not be diabetic to own one. You must not have a husband that is diabetic to own one. You always have to own it because you never can tell the moment it starts setting in. Of course, lifestyle can also make one diabetes at the wrong course of time. Yes, you might not have it hereditary in your gene, but lifestyle can make you be diabetic, and you don't know the point in time you're going to. So you have to have it in order to check your consumption of sugar, which is in turn known by our body as glucose. Okay, now materials you should have. The important medication as a mother, as a father, you should have in your home in case of emergencies. Sometimes maybe at the middle of the night, your children might break down with dysentery. We call it pooing and vomiting and all the rest of them, and you cannot start rushing out to the hospital at that ungodly hour. So what is edge materials you need for that situation? That brings us to the materials you need, the medications you need in your home for first aid treatment. Number one, you need to have Flagyl, either tablets or syrups. It helps to arrest purging. Yes. Secondly, you need to have ORS, that's oral rehydration solution, in order to in order to rehydrate your child or whoever the person is that is having purging or frequent vomiting. Of course, during purging and frequent vomiting, the body loses what? Electrolytes. And in order to replenish this electrolytes, you have to give them oral sugar and salt solution. But in case you don't have the commercially prepared one, you can just mix a solution of salt and sugar. I think the appropriate measurements, when you search, you can get the appropriate measurements. This is the second one. The next thing you should have is tetracycline. It is also used to arrest purging, okay? Another thing you should have is Avomile. It is used to arrest frequent vomiting, anything that goes into their mouth, even the medication they throw out. So the next medication you should have in your house, you should never run out, is paracetamol. Sometimes at the dead of the night, you see your child presenting with a very high fever and you're wondering what is the cause. I just treated malaria. What could be it might just be an infection. But for the meantime, when the doctor is not yet available, you can administer the right dosage of paracetamol just to arrest that fever and go ahead to tepesponge your child to bring down the body temperature. Again, another medication you should have is vitamin C and children cough syrup. Of course, cough is not an emergency, so they can go through the night and in the morning take them to the hospital. Remember, this first aid treatment and equipment does not mean that you should stay back at home. Oh, I have done my best, it's going to settle. No, it means that after giving this one, when gotten the mobility to go to the hospital, you rush the person to the hospital. I've seen a situation where someone died of hypoglycemic state, that's low sugar, okay? He slumped and they don't know, the relatives around didn't know what to do. So instead of using the glucometer to check the sugar concentration, if it is high or low, that could result to that fainting or slumping, they were just there shouting, help, help, help. And before they could get an Uber that is going to the hospital, the person have already gone. This is something a med check can do. If they had checked it and see that his sugar was actually low, they would have just given him Fanta or Coke or anything that has sugar in it, and it will spike the sugar concentration, at least to, even if it's just one gulp, to the extent that it can sustain him and enable cellular activity and not shut down. I've worked in a private hospital and that doctor always do this. Immediately there is an emergency patient being rushed into the hospital, the first thing the doctor requests is for me, being the lab scientist, to come and run sugar check, and the nurses to do what? Check their BP. That way we will know if this patient is diabetic or not. That way we will know if this patient is hypertensive or not. So if the patient is diabetic, we don't go with dextrose saline. That is an infusion given to people. This dextrose saline has sugar, that's the dextrose sugar. So we don't give dextrose saline to patients that are diabetics. So just imagine they rushed your loved one to the hospital and they did not check the sugar or the BP, and we just infused them with glucose, and this person is diabetic. It will just give a spike to the sugar concentration and it will be very high, and we pray it doesn't go to the point where it's going to cause cellular damage. Or let's say the patient is a BP patient and is being rushed, emergency, doctor, help, help, nurse, help, help, and they just came and they started infusing normal saline. Of course, the BP is going to be high, and next thing we might have a shock or a shutdown because of the high blood pressure. So I believe that this my little lecture this morning have given you a picture of how you can save a situation. For low BP, you can just give salt solution little to bring up the sodium, which is going to help heart activity, cardiac activity. Of course, you know that. Then for hypoglycemic conditions, you can give little, anything that has sugar, little, minute amount to just bring up the sugar concentration. Oh, if it is high, you can give medications like, of course, the doctor will prescribe. I don't want to mention anything here so that you won't abuse it. And you will see, before you even go to the doctor will give you an accolade for saving a life even before reaching the hospital. Thank you for being with me. If you like what you have seen, if you like what you hear, and you don't want to miss out on any other information, please stay on my channel, comment, react, share to your loved ones. It can save a life. Thank you and God bless you. Bye.